Hello, my name is Prayer Carter, and today I will be doing my presentation on my research proposal. First, I will start with my problem statement. So, Black maternal health disparities remain a critical public health crisis in the United States. Black women are nearly 3 times more likely than white women to die from pregnancy-related causes, which is a disparity linked to systemic racism, implicit bias in healthcare, and unequal access to quality care. Many report feeling dismissed or unheard by providers with limited availability of culturally competent support throughout pregnancy and childbirth. Okay, and so as an introduction, again, my research proposal will focus on maternal disparities and how it is impacted by culture, diversity, and oppression. We'll also discuss a little bit about ethics and also some recommendations. And just to go more over, the issues confronting Black women in the maternal health care has been longstanding, which is rooted in historical oppression and structural racism. Okay, and despite advances in medicine, the maternal mortality crisis for Black women have worsened over the past 2 decades, even as overall rates have improved for other groups. So therefore, my research question will be, how is access to culturally competent prenatal care associated with maternal health outcomes among Black women in the United States, specifically regarding maternal morbidity, prenatal care utilization, and patient satisfaction? And when we look at the literature review, we see some of the same studies that present that Black mothers face numerous systemic and interpersonal barriers to receiving quality maternal care. Also, Black prenatal women experience significant mental health challenges shaped by intersecting factors such as racism, gender expectations, and socioeconomic stressors. However, the literature does state that despite these challenges, Black women also demonstrate resilience through spirituality, social support, and self-advocacy. The studies underscore the need for culturally responsive, community-driven approaches to improve Black maternal health outcome. Okay, so when conducting this research, this study will use a qualitative research design, which will use surveys, interviews, and focus groups with Black women participating in the Black Infant Health Program known as BIH. This method is best because it's used for in-depth exploration of participants' lived experiences, perceptions of culturally competent care, and also barriers to prenatal services. And then some of the frameworks that I will incorporate in this research would be intersectionality theory, which examines how overlapping social identities such as race, gender, and socioeconomic status and age interact with systems of oppression to shape individual experience and outcomes. I'll also utilize critical race theory, which emphasizes the focus of race and racism in shaping social structures and challenges the dominant narrative that normalize inequalities. And then the data analyst software that I will use, this study will use a qualitative data analyst software called Niveo to organize and code interview and focus group transcripts from participants in the Black Infant Health Program. So using this software will allow for systematic thematic analysis to identify patterns. It'll identify themes and categories related to participants' experiences with culturally competent prenatal care. Okay, and then when we look at the implications for practice, this research addresses the persistent maternal health disparities experienced by Black women in the United States, which is a population for higher risk for maternal morbidity and mortality. So by examining the Black Infant Health Program, this will provide evidence from this research. It can inform state and local health policies. The study can contribute also to a better understanding of human behavior and the context of healthcare and access and utilization. Okay, and then when we look at the impact of cultural diversity and oppression, okay, so again, maternal health disparities among Black women cannot be fully understood without addressing the roles of cultural diversity and systemic oppression. So Black women in the United States experience high maternal mortality and morbidity due to a combination of structural racism, implicit bias in healthcare, and inequalities in access to culturally responsive prenatal care. And again, Black women, this is regardless of education or income, remain at a higher risk for maternal mortality and morbidity due to systemic racism and implicit bias in the healthcare. Okay, and then when we take a look at the ethical concerns of this research, so research on maternal health outcomes among Black women and access to culturally competent prenatal care must carefully address ethical considerations due to the sensitivity of race, health disparities, and systemic inequalities. When considering the NASW Code of Ethics, we can see that several key principles apply here. So we have the dignity and worth of the person. We have social justice, the importance of relationships, integrity, and competence. I did make a note here that it is imperative to highlight social justice for this social problem. A core ethical responsibility is to challenge social injustice. Black women in the United States face high maternal morbidity and mortality rates due to systemic racism and equality access to care. This research seeks to identify strategies that promote health equity, aligning with the code's mandate to advocate for vulnerable and marginalized populations. Okay, and so I do have some recommendations to work to mitigate the healthcare disparities that Black women face. So starting one, support doula integration to support Black birthing people. Adopt respectful maternal care protocols within hospitals and clinics. Implement mandatory culture humility and implicit bias training for all prenatal care providers, and also invest in maternal health equity initiatives at the state and federal levels. And again, to reduce disparities, prenatal care must be reframed as culturally responsive, respectful, and community informed rather than a one size fits all. All right, so integrating culturally competent practices into every stage of prenatal and maternal care, supported by policies that address structural inequalities, has the potential to significantly improve outcomes and reduce the maternal health crisis affecting Black women in the United States we see today. And that is all. Thank you.